Normal heart rate of newborn is, the correct answer is option C, 120 to 160 beats per minute. Newborns naturally have a high heart rate due to increased metabolic needs. The first vaccine given to newborn in India is, the correct answer is option A, BCG. BCG is given immediately after birth. OPV, oral polio vaccine, and hepatitis B are also given within 24 hours. Exclusive breastfeeding should be continued for, the correct answer is option C, 6 months. WHO recommends exclusive breastfeeding for the first 6 months. The most common cause of death in under 5 children in India is, the correct answer is option B, pneumonia. Pneumonia remains the leading cause of under 5 children mortality. The best indicator of child nutritional status is, the correct answer is option A, mid-arm circumference. Mid-arm circumference reflects acute malnutrition quickly. The most reliable sign of dehydration in children. The correct answer is option C, skin turgor. Slow skin pinch, reliable for moderate or severe dehydration. Vitamin K for newborn is given to prevent, the correct answer is option B, hemorrhagic diseases, prevent bleeding due to deficiency of clotting factors. Normal birth weight is, the correct answer is option C, 2.5 to 4 kg. WHO defines normal birth weight as 2.5 to 4 kg. A child with severe protein energy malnutrition shows, the correct answer is option C, loss of subcutaneous fat, visible wasting and loss of fat are key signs. The characteristic sign of a cash walker is, the correct answer is option B, edema. Hypoproteinemia leads to pitting edema. Oral rehydration solution osmolarity recommended by WHO. The correct answer is option B, 245 Moss milliosmol per liter. Low osmolarity ORS reduces stool output. Zinc supplementation during diarrhea is given for, the correct answer is option B, 14 days. WHO recommends zinc for 14 days. Most common congenital heart disease. The correct answer is option B, VSD. Ventricular septal defect. Ventricular septal defect account for nearly 30% of child common congenital heart diseases. Measles vaccine is given at, the correct answer is option C, 9 months. First dose at 9 months under universal immunization program. The main feature of crop. The correct answer is option A, barking cough. The normal respiratory rate of an infant. The correct answer is option C, 30 to 60 breaths per minute. Infants breathe faster than adults. Best site for IM injection in infant. The correct answer is option D, vastus lateralis, safest well-developed muscle in infant. The main symptom of nephrotic syndrome. The correct answer is option B, edema. Proteinuria leads to hypoalbuminemia, causes edema. Rotavirus vaccine protects against, the correct answer is option C, diarrhea. Rotavirus is a major cause of severe diarrhea. The best position for a child with severe respiratory distress. The correct answer is option C, tripod position. Tripod helps expand lungs and ease breathing. Akbar score is assessed at, the correct answer is option C, 1 and 5 minutes. Akbar is done at 1 and 5 minutes to assess immediate newborn adaptation. Normal blood sugar level in newborn is, the correct answer is option B, 40 to 60 milligrams per deciliter. Less than 40 milligrams per deciliter considered as neonatal hypoglycemia. Birth asphyxia is primarily assessed by, the correct answer is option B, Apgar score. Apgar less than 7 at 1 minute indicates asphyxia. Earliest sign of hypoxia in children. The correct answer is option B, tachycardia. Children respond to hypoxia with increased heart rate first. In celiac disease, the child should avoid. The correct answer is option B, wheat. Gluten, wheat, barley, rye causes villus atrophy. First tooth eruption usually occurs in, the correct answer is option C, 6 months. Central incisions erupt around 6 months. A newborn should pass urine within, the correct answer is option C, 24 hours. No urine by 24 hours need evaluation. Most common cause of neonatal sepsis. The correct answer is option D, is group B, streptococcus. Group B, streptococcus, leading global cause of early onset sepsis. The safest feeding method in severe cleft palate. The correct answer is option D, cup feeding. Cup feeding avoids aspiration. Phototherapy for neonatal jaundice primarily reduces. The correct answer is option B, unconjugated bilirubin. Converts unconjugated bilirubin into water-soluble lumirubin. Danger sign in pneumonia in children. The correct answer is option C, chest indrawing. Chest indrawing considered as severe pneumonia. Best site for checking capillary refill times. The correct answer is option B, fingernail bed. CRT more than 2 seconds calculated as poor perfusion. Which vitamin deficiency causes bite out spots? Correct answer is option A, vitamin A. Vitamin A deficiency leads to xerophthalmia, causes bite out spots. Primary management of febrile seizures. The correct answer is option C, diazepam. IV or rectal diazepam stops seizure activity. A hallmark feature of measles trials. The correct answer is option B, Starts on face. Rashes begin behind ears, then face, then trunk. Koplik spots are seen in the correct answer is option C, measles. The most common nutritional deficiency in children. The correct answer is option B, iron. Iron deficiency anemia is most common worldwide. Best diagnostic test for tuberculosis in children. The correct answer is option C, gastric lavage for acid fast bacilli. Child cannot cough sputum, so gastric aspirate used. Dehydration with sunken fontanelle indicates correct answer is option C, moderate. Sunken fontanelle is a sign of moderate dehydration. Normal weight gain in breast feed infants for month. The correct answer is option B, 500 to 800 grams. In first 6 months, babies gain 500 to 800 grams per month. The normal hemoglobin level in 1-year-old child is the correct answer is option C, 10 to 14 grams per deciliter. Normal HB in infants or young children is 10 to 14 grams per deciliter. The most common cause of diarrhea in infant. The correct answer is option B, rotavirus. Rotavirus is the leading cause of viral diarrhea worldwide. Best indicator of dehydration in infants. The correct answer is option D, skin tugger. Skin pinch test is available in infant and children. Recommended dose of vitamin A at 9 months. The correct answer is option B, 1 lakh international units. 1 lakh international units is given at 9 months with measles vaccine. The weight of a child at 5 months is approximately, the correct answer is option B, double birth weight. Weight doubles by 5 months, triples by 1 year. The normal respiratory rate for a 2-year-old child. The correct answer is option B, 20 to 30. Best route for fluid therapy in severe dehydration. The correct answer is option C, IV route. Severe dehydration leads to urgent IV fluids. A common sign of acute otitis media in infant. The correct answer is option D, all of the above. ORS should be discarded after. The correct answer is option C, 24 hours. ORS remains safe for 24 hours after preparation. When does a child start sitting without support? The correct answer is option C, 8 months. Independent sitting usually at 8 months. A sign of rickets. The correct answer is option A, bowing of legs. Vitamin A deficiency leads to bone deformities. Hemoglobin predominantly present in breast milk. The correct answer is option A, IgA. IgA protects mucosal surfaces of newborn. Most dangerous complication of measles. The correct answer is option C, pneumonia. Pneumonia is the major cause of measles-related death. Cough with woofing sound is characteristic of the correct answer is option B, pertussis. Pertussis characteristics are paroxysmal cough plus inspiratory woof. A common cause of iron deficiency intolerance. The correct answer is option B, excess cow milk intake. Cow milk is low in iron and reduces iron absorption. Best method to assess malnutrition in under 5 children. The correct answer is option B, weight for height. Weight for a height. Best method to assess malnutrition. The first sign of puberty in girls. The correct answer is option C, breast bud development, that is telarche. A contraindication for breastfeeding. The correct answer is option C, HIV positive mother. In other countries where safe formula is available. A newborn who fails to pass meconium within 24 hours may have. The correct answer is option B, Hirschsprung disease. Lack of ganglion cells causes absence of peristalsis. A normal head circumference of newborn is the correct answer is option C, 33 to 35 cm. Standard newborn head circumference 33 to 35 cm. A newborn loses up to dash percentage of birth weight in the first week. The correct answer is option C, 10%. Up to 10% weight loss is normal due to fluid shift. The primary reflex absent in newborn with birth asphyxia. The correct answer is option C, sucking reflex. Sucking is more sensitive to hypoxia. The common cause of bronchiolitis in infant. The correct answer is option B, respiratory syncytial virus. Term infant respiratory rate more than 60 breaths per minute indicates. The correct answer is option B, tachypnea. First line treatment for severe croup. The correct answer is option B, nebulized adrenaline. The term infant respiratory rate more than 60 breaths per minute indicates. The correct answer is option C, tachypnea. Normal respiratory for term newborn is 30 to 60 breaths per minute. Respiratory rate more than 60 breaths per minute indicates tachypnea, commonly seen in sepsis pneumonia. Transient tachypnea of the newborn. First line treatment for severe croup. The correct answer is option B, nebulized adrenaline. Croup causes airway obstruction due to subglottic swelling. In severe croup, stridor at rest, distress, the drug of choice is nebulized adrenaline. It reduces airway edema. The most common cause of neonatal conjunctivitis. The correct answer is option B, chlamydia. Chlamydial ophthalmia neonatum appears 5 to 14 days after birth and is the most common cause globally. The best feeding method during diarrhea. The correct answer is option C, Continue breathing. Breastfeeding should never be stopped. Breast milk provide easily absorbed nutrients, immune protection, reduce severity and duration of diarrhea. Earliest symptom of vitamin A deficiency. The correct answer is option B, night blindness. The earliest ocular sign is impaired dark adaptation, night blindness, white or spots and cirrhosis appear later. The most dangerous sign of dengue in children. The correct answer is option D, severe abdominal pain. Severe abdominal pain indicates plasma leakage and that causes risk of dengue shock syndrome. It is a most fatal complication. A common sign of acute epiglottitis. The correct answer is option A, drooling of saliva. Acute epiglottitis is a life-threatening airway obstruction. Clinical features are drooling, difficulty in swallowing, bird position, high fever, cough is usually absent unlike croup. Pneumonia in children is diagnosed mainly by the correct answer is option C, clinical sign. Clinical signs, IMNCA recommends diagnosis based on fast breathing, chest indrawing. These are simple and reliable in low resource setting. A key sign of severe malnutrition. The correct answer is option C, bilateral edema. Bilateral edema, Cashwalker is a severe malnutrition present with bilateral pitting edema, dermatosis, hepatomegaly, apathy. Most common cause of acute gastroenteritis in children. The correct answer is option C, rotavirus. Rotavirus is a leading cause of acute water diarrhea in children less than 5 years. What should not be given in measles? The correct answer is option C, aspirin. Aspirin viral illness can cause Rayleigh syndrome, causes renal failure plus encephalopathy. Which vaccine is contraindicated in pregnancy? The correct answer is option C, MMR. MMR is a live attenuated vaccine contraindicated in pregnancy. Most common cause of anemia in children in India. The correct answer is option C, iron deficiency. Iron deficiency anemia is widespread due to malnutrition, excess cow milk, hookworm, poor dietary intake. The classical sign of nephrotic syndrome. The correct answer is option B, edema. Nephrotic syndrome. Characteristics are massive proteinuria, hypoalbuminemia, generalized edema, hyperlipidemia. The main electrolyte imbalance in diarrhea. The correct answer is option C, hyponatremia. Diarrhea causes loss of sodium and rich fluids that leads to hyponatremia. Severe dehydration can cause metabolic acidosis. Best management for febrile seizures at home. The correct answer is option C, turn child to side. Lateral side prevents aspiration of saliva or vomit. Do not restrain the child or insert objects. Which sign indicates severe dehydration in children? The correct answer is option C, very slow skin pinch more than 2 seconds. Slow skin recoil is the most reliable sign of severe dehydration. Age at which a child can speak 2 to 3 word sentences. The correct answer is option B, 2 years. At 2 years, child combines 2 to 3 words. The first dose of DPT vaccine is given at the correct answer is option C, 6 weeks. Primary schedule 6 weeks, 10 weeks, and at 14 weeks. Most common cause of congenital hypothyroidism. The correct answer is option D, thyroid dysgenesis. Agenesis, hypoplasia, ectopic thyroid are the major causes. Main symptom of ADHD in children. The correct answer is option B, inattention and hyperactivity. Best investigation for interception. The correct answer is option C, ultrasound. Main feature of heartstring disease. The correct answer is option B, failure to pass meconium. Which vitamin prevents neural tube defects? The correct answer is option D, folic acid. Cause of seizure gait in children. The correct answer is option C, cerebral palsy. Spastic cerebral palsy causes adductor spasm, leads to seizure gait. Most common cause of acute otitis media. The correct answer is option C, Streptococcus pneumoniae. A last sign of increased intracranial pressure. The correct answer is option C, Cushing trait. Cushing trait includes bradycardia, irregular breathing, hypertension. Which congenital heart defect causes a machinery murmur? The correct answer is option D, PDA. Patent ductal arteriosus. Preventive measure for rheumatic heart disease. The correct answer is option C, penicillin treatment of sore throat. Treating strep throat prevents rheumatic fever. A child with celiac disease should avoid. The correct answer is option C, wheat. The most specific sign of meningitis in infant. The correct answer is option C, bulging fontanelle. Drug of choice for status epilepticus. The correct answer is option C, diazepam or lorazepam. Common cause of respiratory distress syndrome in newborn. The correct answer is option C, surfactant deficiency. The first permanent tooth erupted usually. The correct answer is option D, first molar. At 6 years, molar is the first permanent tooth. At what age does a child develop pincer grasp? The correct answer is option C, 9 months. A newborn with grunting, chest indrawing, and respiratory rate at 70 breaths per minute likely has. The correct answer is option D, severe pneumonia. IMNCI danger signs of pneumonia says fast breathing, chest indrawing, grunting. These indicate severe pneumonia requiring urgent treatment.